Okay.
Okay, so clinical. So you watch the video and you kind of get like the formula.
Yes, I think
Because the
so.
formula is kind of like armor of like, no matter what they ask, I can just throw out this like vague stuff and it'll fit.
I did have one question about the formula.
Yeah.
Would it be important? I guess it might depend on the situation, but is it more important to assess the patient first or call for help first?
Kind of both. It really
Both.
depends on the situation.
Okay.
So, like, generally, because I feel like people are like, oh gosh, what's the right answer? And they don't like
Yeah.
imagine themselves there. So, like, you
Yeah.
imagine yourself walking in and your thought is like, this is bad, but like, how bad is it? Right? Like,
Yeah.
do they have a pulse? Okay, cool.
Mhm.
Can they like, are they awake and talking? Cool. Do they have vital signs and do they suck? Okay, we're good. Um, can they tell me what happened and like
Mhm.
what symptoms can they give me? Like I want more info. And like look at like if there's blood, where is it coming from? Like if they vomit, like what did it look like? Like
Mhm.
did they injure themselves? Any of that stuff that they can tell you. Um, and then while you're doing that bit, you're maybe like sitting them up if it's like a respiratory
Mhm.
thing. Um, and like a lot of times while the blood pressure cuff is like, you want to say vitals like within the first few sentences. And you could say,
Okay.
while I am cycling a set of vitals, I would press the call button and ask for the charge nurse to come to
Mhm.
bedside, and you can say anything that you'd want her to bring, like Zofran or like the EKG machine or whatever.
Okay.
Um, and then you could say like if it's something super urgent, while I'm asking questions about any symptoms or what happened, I would ask that the charge nurse um, uh, touch base with Rapid and see if they'd like to come to bedside or any recommendations that they
Got it.
have.
Okay.
um, and then kind of at the end of all of this, you would say like, and then I would reach out to the team and see, let them know what had happened and any um, changes, and then see if they'd like to do any other workup at this time. So
Mhm.
if you're like really stumped and you want to go vague, like pulse, they can talk, vitals, um, get the charge nurse. And then if you have no idea what to say for like what labs or like imaging or whatever they might want, you can literally just say, I would reach out to the team and let them know what had happened,
Mhm.
and then ask if they'd like any other workup at this time, maybe imaging or labs or whatever
Okay.
they would like to do. And
Got
that's
it.
super vague. You get the answer
Yeah.
right, whether it was like a troponin or like electrolytes or like they wanted to give blood or like whatever it is, you covered bases by
Mhm.
saying, I would let them know what
Got
happened
it.
and ask what other workup they wanted this time, like labs or imaging or anything like that.
Okay.
Cool. So you have that to use no matter what they ask you.
Got it. So if mine goes blank, just
Just
keep it
roll with
vague,
all
but
of that
keep it right.
and you get
Got
like
it.
80% of the answer right.
Okay.
Yeah. The other things are just kind of picturing yourself there and like, what info do you want to know?
Mhm.
So what would you do if you um walked into your patient's room and they had increased work of breathing and they had cyanosis?
If they had increased work of breathing and cyanosis, I would immediately call Rapid. I think that would be the first thing I would do because even though I don't have a set of vitals based on their appearance and their presentation, I think it's a justified cause enough to call Rapid, let them know the situation. After that, I would get a set of vitals and perform any intervention. So if they're low on oxygen, I could get the nasal cannula and put that on the patient. In addition to calling the CNA immediately after, or not the CNA, the charge nurse, and let them know about the situation and any further equipment that I would need from the supply room if I needed that. On top of that, I would I feel like I'm missing something. Well, for the vitals, I would mention, of course, like the pulse and everything. Um, get a blood sugar check just in case if they're hypoglycemic.
That seems a little odd. The blood
Oh,
sugar.
oh, sorry, never
I'm
mind.
thinking like, what's their respiration and like what's their oxygen saturation?
Got it.
Yeah.
And then after that, would I think? Mm, could I? Would it be fair to say like, could I check if they had any allergies or like check the MAR to see if
Yeah.
they're allergic to
100%.
anything? Okay, that's what I was thinking too. And trying to identify the cause, of course, after treating them and making sure they're back to baseline or back to their level of vital signs that are not abnormal. And then let the physician know that of the situation and how the patient presented, their respirations, their depth. I would like auscultate and let them know like what I hear and if there's any recommendations he would want me to do from there.
So I'm trying to remember all the things I wanted to add. So you could say that when you call rapid, that from what you understand,
Mm.
it's a nurse and an RT. So that way you're looping in the respiratory therapist like right away.
Yeah.
And then
Mm-hmm.
you could talk about like sitting them up. I don't know if you said
Oh yeah,
that.
about that. No, I don't think I did.
And then you could talk about like if they are like already on 6 liters and they're not recovering, that you
Mm-hmm.
put them on a non-rebreather.
Okay.
And then when you're talking to the provider, oh, you could also ask like, do they have any pain?
Okay. Got it.
um and then for when you ask the provider, um you could ask if they want like a blood gas or if they want a chest x-ray. Those are two things you
Okay.
could throw out
Okay.
because that's sort of like their wide net they cast for like respiratory things: chest
Got it.
x-ray and blood gas.
Okay.
Yeah, and that'll cover like VBG or ABG, you know what I mean?
Yeah.
Cool. All right. What would you do if you came into your patient's room, or let's say, you were cleaning your patient and then all of a sudden they started to have a seizure? What would you do? And you're in there like with the nursing assistant, let's say.
Immediately perform the assessment of turning them to their side so they don't aspirate. If they're on the bed, I would make sure it's flat and it's not at 30 degrees or anything. Depending if they're on the ground or on the bed, make sure the surface is flat and make sure that there's no item or no like objects that get in the way of the patient. If they're wearing anything that would be tight, which probably not because they're in the gown, but I would try to make sure like they're not tight in any of the areas of their clothing. On top of that, I would get the oxygen at hand and let the charge nurse know that of the situation. I say get a set of vitals and assess, or can I say like note the time of the seizure, or like try to
Both.
time it
Yeah.
and okay, time the seizure and like how the patient's presenting,
Try to get a set
and
of vitals too. Why not?
yeah, set of vitals with that. Immediately after that, say if they kind of return back to baseline or they're kind of back out of the seizure, make sure that, of course, their vitals are all back in the normal range, and call the physician, and let them know about the time of the seizure, the symptoms of it, and if they wanted to get like an MRI of the brain as a recommendation for any electrical activity, and if they're on any anticonvulsants. So yeah.
So you could say I would call my nurse, or I would call my charge nurse and ask her if she could bring any Ativan or any PRNs that might be
Okay.
available if this is something that has been ongoing and the patient might already have an order. But if it's the first time, they won't.
Yeah.
Usually what they want to do is they want to start EEG, which like the EEG techs come in and they glue all this stuff to their head and they like watch it for I don't know, however long.
Okay, got it.
Um, yeah, and then you could say like kind of describe the post-ictal period as
Okay,
well. See if they'd like any EEG or any PRNs just in case, like PRN Ativan, just in case there's another seizure in the future.
okay.
Yeah. And then to make sure there's a fall alarm and like pad the bed rails and
Hmm.
make sure like you have suction set up going forward.
Okay,
Yeah.
got it.
Yeah. Perfect. Okay. So what else? What would you do if you came in to your patient's room and the patient appeared to be asleep and you saw that they had vomited blood?
Um, I came to the patient's room and they're asleep and they vomited blood. I would immediately get a set of vitals on them, get their perform a neuro check and get a set of vitals. Check for a pulse first, um, and then call the charge nurse and let them know what happened. On top of that, depending on their vitals or if they're conscious or not, I can call rapid response or let them be in the loop of the situation. Um, After that, I would put the head of the bed up just so they're not don't choke on their own blood or anything, and call. Um, if I'm missing something, but call a physician and let them know of the consistency of the blood, if it's how much or the estimate in milliliters and the consistency of it, if it's dark red or light red, or and probably check if they recently had a surgery because it could be sign of hemorrhage or anything if they're unstable or stable. Try to like gauge that. Um, and maybe get like let the doctor know and try recommend like maybe getting some fluids or some blood, maybe to get a transfusion if it's a lot of blood, anything along like that.
Okay. You could also ask if they have any abdominal pain, they feel
Mm,
dizzy.
mm,
Um, and then in terms of what the doctor would recommend, I feel like the standard is they usually want a blood count. Like they want to see like the hemoglobin and
mm,
hematocrit
got
just
it.
to see like, maybe they transfuse if the hemoglobin is less than 7 or whatever. Or like if they
Got it.
drop 3 points, like they're probably bleeding.
Mm,
Um, so see if they want a blood count and coagulation studies.
okay.
Um, and then they also usually like if they think there's a bleed, sometimes they want a CT.
Mm,
Um, but yeah, if you're like, and if you don't know, you could just say like if they want any labs or imaging,
okay.
and that covers it.
Yeah.
You're
Yeah.
really good at these.
Thank you. I
Yeah,
appreciate it.
it's
I've
like
been
boom,
studying
boom,
your
boom,
videos.
boom.
I've been looking at the videos
Okay,
and
cool.
trying to get a
Yeah,
good idea of it.
yeah, you're ready for these.